Good afternoon, ladies and gentlemen. Welcome to today's seminar. My name is Mohamad Ahmad Abir. I am from the National Cancer Society of Malaysia, and I'm delighted to be your moderator for today's session. As you may know, the World No Tobacco Day is coming up on the 31st of May 2023. To celebrate, we from the National Cancer Society of Malaysia have organized a series of webinars titled Harms of Harm Narrative of Harm Reduction Strategies in Tobacco Control and their impact on public health. Over the next 8 sessions, we will be exploring various aspects of harm reduction in tobacco control, understanding the issues with vaping and health communication strategies, and dispelling those common myths and misinformation for all tobacco control advocates. We have invited representatives who are strong advocates in the field of tobacco control to share their expertise and insights in support of the series of talks. Today's session is the 7th in the series, and we will be exploring the topic of advocating against harm reduction a societal perspective. Due to some unforeseen circumstances, Dr. Murali and Dr. Noriana will not be able to join us for this session. However, we still have some speakers today to talk about the topic. Okay, so our speakers today will be Dr. Mah Wen Yi, a public health executive at the National Cancer Society of Malaysia, and we are honored to have Dr. Nurhaliza Zakariah, who is a public health medicine specialist at the Senior Principal Assistant, who is a public health medicine specialist and the Senior Principal Assistant Director for the Tobacco Control Unit and HCPs for joining today's session. So thank you for both doctors for joining today's session. As the first speaker for today's session, Dr. Mah Wen Yi will be providing us an introduction to the topic of advocating against harm reduction. Followed by Dr. Nurhaliza, who will be sharing on advocating within the daily healthcare process. If you have any questions, feel free to ask them on Dr. platform, and our speakers will answer them as soon as possible within the allocated time. So Dr. Wen Yi, over to you.
Right, thank you, Ishak. So I will be presenting my slide first. Give me a second. So I think it should be fine. Yes, all right, thank you for replying. All right, so good afternoon, everyone. My name is Wen Yi. I will be presenting today on behalf of Dr. Murali. So let's just jump right into the topic of today, which is to advocate against harm reduction, a societal approach. Now, first of all, I think the most important thing to address is that we need to understand the roles of healthcare professionals in tobacco control advocacy. As we all know, tobacco and tobacco-related products are the main causes of preventable health conditions globally. And this is widely known already, such as like cancer, cardiovascular diseases, stroke, etc. Everyone knows this. And since healthcare professionals are sort of the first people that patients will turn to for health advice, it is compulsory, or another word is mandatory, for healthcare professionals to provide support in not only treating, but also preventing these illnesses. Now, this is heavily promoted nowadays, right? Because many countries, we want to put more emphasis on the role of primary care in preventing diseases rather than to just treating diseases. This is the new way of approaching health nowadays. Usually, health prevention will involve improving health awareness, health promotion, and also health education. In terms of tobacco or tobacco-related products, there are actually various ways that healthcare professionals can go about doing this, and that's what we'll be exploring today. First of all, providing accurate information is one of the most important things that a healthcare professional can do, especially because we live in an era of information overload or a lot of misleading information that are spreading around like wildfire. And of course, nowadays, we tend to look things up on the internet before anything, right? So knowing some good websites is really, really crucial when we're educating patients. So for instance, here I have attached a screenshot here of the PAHO. I'm not sure how to actually pronounce it, probably PAHO, which is the Pan-American Health Organization. And they have an article that lists out more than 100 reasons to quit tobacco, for example. And I think the first thing they mentioned is that smoking worsens COVID-19 outcomes. And that's one really, really good way to start off the article, right? Because the information that they provided is up to date and it is really applicable to the current times. And these are all very, very well-researched facts as published by WHO and also PAHO. And they're written in very simple language as well. So it's definitely a good place to turn to when we're trying to talk to our patients about smoking cessation. Now, we talked about information overload just a minute ago and about misinformation. And this second point here is closely related to the first one. Now, misconceptions and myths are very, very dangerous nowadays. All right. I think one of the most popular things that people talk about is that smoking helps patients relieve stress, as you can see here in like bullet point number 5. And that is why people still smoke, even though they are very aware of the harms, because it's promoted by a lot of health agencies that don't smoke, it's very harmful for you, but they still do it because it helps them feel better. Now, here I found an article from the Australian NSW, the New South Wales Health website, and they basically said that smoking doesn't actually help you relieve stress in the long term because nicotine itself actually causes an increased release of stress hormones. Smokers also only feel relaxed because they're experiencing nicotine withdrawal symptoms. And once they smoke, then they feel relieved by the symptoms. So that's how it works. But a lot of people are not aware of like the physiological mechanisms behind it. And a lot of simple articles like this can really help debunk such a myth. So yeah, just simple myths and facts, debunking myths can be very helpful for patients to understand things. And I think these articles in particular are extremely useful because they are laid out in very easy to read format. They're in point forms, it's very attention grabbing. And so the bite-sized information are also very, very easy to process and digest. Now, it goes without saying that healthcare professionals should advocate for patients to quit smoking as much as possible, right? This is one of our biggest jobs. KKM has the M-Quit or Jom Quit services in every clinic kesihatan, and then the process of signing up or registering for it is quite straightforward. You just, if I'm not mistaken, you just go on the website and then you register your email, and then they will send you some emails to provide you with further instructions or information. So that's one thing we can do. Now, the point number 4 is kind of the same as number 3, basically referring them to M-Quit services so that they can receive the necessary counseling and pharmacological interventions if it's deemed necessary. Now, another way is to be trained to deliver quit smoking services and to do it independently in their own setting. What this means is, like, for example, basic concepts for counseling are usually already taught in med school, as I also learned it when I was in med school already, when we did our public health rotations, for example. So I think most of us are familiar with the 5 A's approach, the asking about patients' smoking status, advice on the harms, assess the patient's understanding, assisting them, and also arranging a future appointment to check how far they've come. And then the STAR method, the set a quit date, tell family and friends, anticipate challenges, remove all tobacco products. And then we have to assess the patient's stage of change according to that model, whether they are pre-contemplation or contemplation, and then so on. So these are all done on an SDL basis. And I think, self-studying is a very good way for us to be better tobacco control advocates. So of course, there are also more systematic ways of learning them instead of just doing self-learning. And I'll give an example at the end of this presentation. Now, unfortunately, many healthcare professionals are not aware about their own roles in the tobacco control advocacy, while most healthcare professionals agree that tobacco and tobacco-related products are not good. They're not safe and they're harmful, but they don't have the training necessary. And then there was a paper that actually quoted less than 10% of healthcare professionals who played active roles in tobacco control. Now, this is quite unfortunate because healthcare professionals have direct access to patients, right? And we have so much potential to provide health education and improve awareness, but we're not utilizing this benefit and this position that we're in. So something to take note of. Now that we already know why healthcare professionals play such important roles in advocating for tobacco control, we can go deeper in now and then to talk about how we can practically achieve a good form of tobacco control advocacy. Funnily enough, the first and easiest thing that we can do as healthcare professional turns out to be harder than expected. So we must first of all act as positive role models to our patients. What I mean by this is that we should not smoke, right? But we all know one or two doctors nearby who actually smoke themselves, and this can make things a bit difficult because studies did show that up to a third of healthcare professionals themselves use tobacco products or smoke. So when healthcare professionals use tobacco themselves, they are less likely to be, to become an advocate for tobacco control. In addition, when patients talk to them and then, or when they are in the hospital and then they see a doctor just going for a smoking break, that will, of course, affect their credibility, and people will not trust the doctor anymore, and then they will not even think about quitting because we are supposed to be the benchmark of health. So this is a very contradictory thing that, and very basic thing that we should do, which is to not smoke. Next, the second one is to provide supportive and also non-judgmental care to patients to assist them in cessation efforts, to help them in quitting smoking. Now, this is a very essential principle in patient care, because being supportive and non-judgmental will make patients feel safer in approaching healthcare professionals when they want to quit. It is very, very important to adjust our perspectives on cigarette use. So, for example, some will think of it, some will think of nicotine use as sort of a moral issue. And that's why, they think that the patients are being irresponsible, and so they do not deserve any kinds of treatment, and they do not deserve to get better. And this is very wrong, because it just goes against the Hippocratic Oath, right? That we should not do any maleficent things. And also we should not just judge. So instead, we should, if we view it as an addiction issue rather than a moral issue, then we will be able to address nicotine addiction as like a clinical condition whereby the patient requires very holistic and also integrated treatment. And that patients will require professional help in order to wean off the substance, which is nicotine or tobacco products. The take-home point here is just that healthcare professionals must incorporate or need to incorporate a human and empathetic approach. As I mentioned earlier, it has to be in line with the Hippocratic Oath. Next point is that we must integrate tobacco control into daily practice. So one simple thing to do is, like, when we do any kind of history taking, which we do on a daily basis, healthcare professionals need to clearly understand how severe is the patient's dependence on tobacco, and not just smoke years. We need to, not just pack years of smoke, but more on how addicted are you? How much do you depend on tobacco products? This needs to be included in the patient's notes, because in the future, when we do counseling, we can counsel according to their severity levels. And in the next slide, I will show you some example measuring scales that you can use in assessing the patient's dependence severity. So the key here is to always emphasize smoking cessation, to always emphasize and promote them to quit smoking to the best of our abilities. But the key here is that we must make it relevant to a patient's situation or diagnosis or lifestyle. So, for example, people can be from very different socioeconomic backgrounds or educational backgrounds. Some people from low socioeconomic status, they need to go to, they need to work, and then they don't have the time, or they don't have the money to afford some kind of pharmacological treatments. So maybe healthcare professionals need to be able to adapt and be flexible and advise accordingly. Now, healthcare professionals also need to repeatedly reinforce and emphasize this. Now, this is how we learn anyway. When we read and study textbooks, we have to read it many, many times in order to get it into our brains. Same thing happens to smokers. So if you keep on re-emphasizing the same principles again and again regarding smoking, regarding the harms, it has been proven to be effective to make it more likely for individuals to quit. So this is important to repeatedly remind your patients. So here are 3 different measuring tools that we found that you can use to assess someone's dependence on cigarette or e-cigarette. The first one here on the left, the black and white one, is by a Penn State. It's called the Penn State Electronic Cigarette Dependence Index. As you can see, they clearly outline the scoring system as well after asking 10 questions. So out of the 10 questions, the patients can rate, like for example, how many times a day they have to use their electronic cigarette. And then if you score 0 to 3, then it's not dependent. If you score 4 to 8, it's low dependency, and things like that. So the second one on the right here, the sort of yellow one, is called the Heaviness of Smoking Index, which is a measure developed and published on the Tobacco Control BMJ journal, while the last one is called EASI, EASI, E-Cigarette Addiction Severity Index, specifically designed for e-cigarettes and also developed and published on the Tobacco Control Journal. In the past few Advocacy sessions, we've talked about how like e-cigarette can cause addiction, and because of its nicotine content, it's good to have some kind of objective measurement tools to assist in our management planning. So it's not just cigarettes that we can measure, we can now also measure e-cigarette dependence using these measuring tools. Now, the fourth point here is to make sure that healthcare facilities, workplaces, and environments are smoke-free. It can be a bit funny if your health environment is it smells like cigarette smoke, and then patients will be unhappy, and patients who are smokers will probably think that it's okay to smoke, right, around the healthcare facility. So similar to our first point earlier, it is very, very contradictory if a healthcare facility smells like cigarette smoke. This can also make it a safer spot for, like if we tried our best to encourage smoke-free health services, then hospitals, clinics can become safer spots for vulnerable communities like children or women. So the point here is really just very simple: make sure that health settings are smoke-free and also safe as well. Next, we'll talk about how healthcare professionals have to play a leadership role in tobacco control. Now, we as healthcare professionals, we have inherent social capital because we are considered professional roles and we are deemed to have a voice in society, especially when it comes to voicing out about healthcare issues and also tobacco issues. We are well suited to play leadership roles, not just within our own small communities. We can even do it on a national or international level to become tobacco control advocates. So I think, for example, has the APAC meeting every year. You can join things like that and then learn from each other, and then learn how to advocate better in our own, and bring it back to our own communities and try to apply that. Next, we have some practical, actionable ideas. So previously we talked a bit about like the abstract ideas of how we can apply certain principles, but now it's not about principles, now it's more about actions. So the first thing we can do is to write letters or just an open statement to the editor or op-eds. It's called it's just op-eds of tobacco control policies and also activities. Here I have a screenshot of NCSM's recent op-ed that was published by Code Blue regarding World Cancer Day. So that's what we do, right? We advocate for cancer prevention. We advocate for cancer health. So what will you do to close the care gap? This is our title, our topic, and our team wrote this, and then Code Blue published it. Code Blue, as you all know, is a very it has a very wide-reaching audience. So a lot of healthcare professionals read this. And so people will read about it and then they will talk about it. And that's how you start a conversation. And when you start a conversation, it will gather more attention to the specific issues. So we can apply the same concept and do it for tobacco control instead. So you can write about tobacco control in your own name or on behalf of an organization or on behalf of your hospital or your department, things like that. Now, other than submitting articles to news outlet or news media, we can do something even easier or simpler, that is to email or speak directly to your local MPs and also ADUNs to express support for your tobacco control proposal. So find out who your local reps are and also organize a conversation with them. More often than not, change can be made only when the healthcare professionals are able to provide advice to the policymakers. So this is public health in a nutshell, right? So you're trying to make change on a larger scale and not just in a clinical setting. And it's hard to make a change when there's no collaboration between the policymakers and also the professionals of that specific field. The next step is to, involve yourself in community tobacco control activities. For example, your own condominium, if you live in an apartment or a condominium, you can have, you can create a community where you promote smoke-free efforts, make sure that no one in the condo smokes, by approaching the management community or becoming part of the management community. This is not just something that healthcare professionals can do, but anyone can do. And just because you're a healthcare professional doesn't mean you don't have the responsibility to do this. You are just a community member, so you can do this as well. And another thing is to promote smoke-free efforts in school through the PIBG, for example. So if you have children, you may be a part of the PIBG community or the part of the committee members as well. I think this is quite self-explanatory, just be part of the community. And I think last month, KKM did a survey called Kotak, and they found out that more than about 40,000 school students are smokers. So this is a very, very concerning number. And I think that community efforts such as PIBG, like we mentioned earlier, can assist in reducing this phenomenon. Like it is not the solution to it, but at least you start to have some kind of idea to start changing things, to start talking about resolving these issues of children smoking or using e-cigarettes or vaping, things like that. Another thing that can be done in a workplace, for example, in hospital or clinic settings, is to set up a committee to drive awareness about tobacco control issues. So, for example, measures I shared earlier about e-cigarette use, the easy measure, can be used and implemented for every single patient who is a smoker or an e-cigarette user, right? So ensure that you have a complete tobacco history. Don't ask just about the pack years, but also use that measure and apply it to every single patient in your particular department, for example. Of course, another thing that you can do in a workplace is to create a smoke-free workplace initiative and just encourage everyone to not smoke, make sure that the hospital is clean and no one smokes in the hospital. Not only can you integrate tobacco cessation into practice individually, which means that you become a role model, you don't smoke, and also you make sure to advocate for tobacco cessation in every single patient encounter in the clinic or in the hospital. You can also integrate it into an institution, like not just yourself. You can sort of influence your colleagues. You can also influence your seniors into being into becoming advocates as well. So for example, if you work in medical or surgical team, orthopedics team, you can encourage this in your own team and let it grow from there. Maybe it starts off as your individual and then you tell your whole team and influence them to become tobacco advocates. And then after that, your entire hospital, who knows, may eventually also become strong advocates for this as well. And then I think this is actually my last point already, but this is quite crucial, that you need to lead the training and also awareness efforts in your workplace and community. So like we mentioned earlier, less than 10% are actually actively participating and becoming tobacco control advocates. That is because there's a lack of training, and also people just don't tend to go and learn about tobacco control. Like I mentioned earlier, it's very easy. You can learn it yourself, the 5 A's, how to counsel, do some basic counseling regarding tobacco control. But you can also participate in what's called the Scope Training Program that was organized by So this program kind of teaches you, I think it's a full day program, an 8-hour program that you can participate in, and then you can learn more about how you can organize, plan, and also execute the training for smoking cessation. So I think this is quite useful. And not just this, of course, if you Google online, there are quite a lot of tobacco control certificates that you can get by performing some, I think it's just like online courses that you can do to train yourself to become a smoking cessation expert or specialist. Of course, it's not the only thing you can do. You also need to improve yourself with more experiences, but I think this is somewhere to start. So like we mentioned, attending just a 1-day training program can already do a lot to improve a healthcare professional's understanding on tobacco control. This will, of course, make you feel more confident and also empowered to conduct a smoking cessation program within your own settings. So like I mentioned, it is a 8-hour, 1-day program that have been proven to significantly improve knowledge, rectitude, and also self-efficacy of the healthcare professionals who attended. So so this is sort of the end of my talk already. I will just end it there. So I think it's just one final note is like just to start somewhere. If you don't know where to start with yourself. If you've already started with yourself, maybe start with the people around you and then just slowly go on from there. All right, so that's all from me. Thank you so much. I will stop sharing now.
Okay, thank you, Dr. Wen Yi, for your comprehensive presentation on navigating against harm reduction in regards to tobacco control. Now let's welcome Dr. Nurhaliza to share her thoughts on advocating within the daily healthcare process. So over to you, Dr. Haliza.
Thank you. Can you hear me well?
Yes, I think we can hear you.
All right. So let me bring my slide on. All right. So can you see my slides?
Yes, I think we can.
All right. Thank you. So very good afternoon, everyone. Thank you for having me today. So I will speak on a topic, advocating within the daily healthcare process. So after listening to Dr. Mah just now, I think we have a better understanding on what our role and what can we do to help our client and patient throughout our daily healthcare process. In fact, so we know as a general, there are a lot of processes involved in healthcare. So this is just mentioning a few. So I just want to highlight whoever you are, or whatever you do, you have a role to play. Right. So I know for today we focus on healthcare professionals, like seeing patient and client. Maybe in clinic, maybe doing investigation, etc. All right. So Dr. Mah has elaborated quite a lot on in terms of the role, what you can do just now. So this is just like a basic what you can do to help the patient. Of course, you need to start off with know your client health status, your patient health status. Well, I want you to not to forget to ask about the smoking history, which can help you in categorizing your client, whether they are a smoker, maybe an ex-smoker, or even current smoker. So that's where you can further help your patient. And of course, maybe while seeing your patient in the clinics, even the hospital, doing admission, just try to take the opportunity to conduct screening for your patient. And of course, if you find your patient is a smoker, so basically it's like a spinal reflex that you need to advise the patient to smoke it. And of course, if you have the credibility of you are certified to provide the treatment for smoking, of course you can initiate the treatment. And if you are not confident enough, you can always refer the client to the other facilities that provide the smoking services. And of course, again, as mentioned by Dr. Mah just now, you yourself can become an advocate. And at the same time, I would like to highlight, maybe you can also get the patient themselves to become an advocate and distribute the information that you convey to them to their friends and families. All right, so pertaining to the series of this webinar related to the harm reduction of tobacco control, so I would like to speak a bit on the electronic cigarettes. So by definition, it is a handheld device which is equipped with aerosol generator, battery, and solid storage area, and the purpose is to deliver the nicotine of other chemicals via aerosolization. And I just want to show you there's a lot of variation in electronic cigarette and how fast the technology has grown and evolved throughout the years. Right. So the industry has been promoting e-cigarette as a safer alternatives, so they have been putting up various evidence showing that vaping is less harmful as compared to the conventional cigarettes. But we all know that health effects takes longer to occur. This is like a very, short term that they find, right? And what they show is actually this is very superficial comparison between the electronic cigarette and also the conventional cigarettes. So that's what has been key to the community nowadays, promote as a safer alternative. And of course, in Malaysia, we are not, not far behind. So this is how they promote e-cigarette as a quit smoking tools, which I believe is not entirely correct. So, a lot of signage, posters, and even in the social medias widely distribute this kind of information. Right. So, as I said just now, we don't think that electronic cigarette is, used as a suitable method for smoking. So when you see your patient, so we don't want to offer this kind of this electronic cigarette as an alternative. Let me explain why. So when people smoke the conventional cigarettes, so like within few seconds, like 10 seconds, the nicotine level will achieve the high concentration. It will give signals to the brains, right? Then over time, the nicotine level goes down. So when you look at how the mechanism, right, of the nicotine delivery by the conventional cigarettes and also the electronic cigarettes, actually the mechanism is similar from when compared between the conventional cigarettes and also the electronic cigarettes. So do you think, which is, we think that it is very unlikely to help people to quit smoking, so it's still becoming an addiction, all right? And, and of course exposed to a lot of ill effects of the electronic cigarettes. All right. Okay, so as early as 2015, there is actually already evidence produced by a research center for WHO. So by this time, the United States market for electronic cigarettes is about 9 years already. So within 9 years, there's already a systematic review of health effects of cigarettes before public. And a total number of 175 studies were identified and included in this review. And, 34% of the studies actually has relationship with the tobacco or the vape industries. All right. So one of the conclusions mentioned in this report, so like we say that more than half were studies involving fluid and vapor. So they found that there's no fluid or vapor free from toxicity. And of course, with this, evidence, why do we want to offer this to our patient, And of course, the same report mentioned that even though the industry is claim that using e-cigarette as an alternative, for harm reduction. However, this report by the WHO report shows that almost 80% actually do not quit smoking, even when they switch to e-cigarettes. But instead, they become dual users. Of course, with dual users, reduction harm can hardly be expected. And the next more recent evidence in 2020, the US Department of Health and Human Services has published a report. So this report actually mentioned that there is inadequate evidence to conclude that e-cigarettes in general increase smoking cessation. And in the next, more recent evidence by also WHO in 2021. So it says the ENDS. ENDS stands for the Electronic Nicotine Delivery Systems, heterogeneous product class that continues to evolve at a speed that outpaces the current regulatory efforts. Meaning, even we in Malaysia, we do not have any regulation yet to control this rate. And at the same time, the ENDS performance characteristics are also heterogeneous, and some users being exposed to very low level of nicotine and other toxicants, and others being exposed to very much higher level. So the level of exposure varies between the electronic cigarettes. And of course, the flavored and liquids contribute to the initiation and also maintenance of the end use, which among previously nicotinized in non-smokers, right? So meaning that even the non-smokers become the smokers, and the vape users, right? And again, the most end users do not keep smoking combustible cigarettes with the conventional cigarettes, but rather use both the electronic cigarettes and also the conventional cigarettes, as I mentioned earlier. And this is report by Ivali Wiki and Ivali Abir in US, right? So the electronic cigarette has been introduced since 2002, if I'm not mistaken. And along the years, we had a very first Ivali outbreak in 2019. So Ivali stands for the electronic cigarettes and vape use associated lung injury, right? So the first outbreak in 2019. Right, so from the use of the electronic cigarettes, so we can divide into Ivali, the lung injury associated, and also the Ivali. So for the Ivali, we already have a guideline for that. I will explain that to you later. All right. So in the US in 2019, if I'm not mistaken, all right. So the first outbreak I mentioned earlier, whereby they suspect a lot of death and also respiratory illness associated with breathing. And of course, one of the substance that is mentioned, listening acetate, it was identified as sleep. And some people say that the vape in Malaysia is not similar because we don't have the vitamin acetate. However, we still actually see Ivali cases even without the vitamin acetate. So this is the peak of the outbreak in 2019, whereby there were 2,807 cases with 68 deaths, right? So how about Malaysia? So in Malaysia, we in the same year, 2019, we received 2 notifications for Ivali cases both are teenagers, one in Labuan and so another one in Sarawak, whereby they were treated in ICU and also sustained respiratory illness. I think it has complication. And there's also a study done locally in 2021, right? So this is done by So from this study, we can see there were 3 Diwali cases, 5 probable cases, and 20 non-Diwali cases, right? So I think among these were young, 20 to 30 years old, and I think only 1 cases actually reported 70 years old. So I mentioned earlier, so this is the clinical practice guidelines. So you can look up, it is available in our Ministry of Health website, to the management of e-cigarette or vaping product use associated lung injury. So Diwali. So this can help you to actually identify a patient that you can suspect to have Diwali. All right. So this is some consent to how to define Diwali cases. You can look up and read further. I'm going to read one by one. So we have this definition for the probable case as well. And bear in mind, these cases need to be notified to the nearest health office if you suspect invalid cases. Right. So my question is e-cigarette or vape is safe to the non-smokers? Of course, it is not. So we don't want to start something that's not there. How about the ex-smoker? Of course, it is also not beneficial to them, as mentioned, evidence has shown. In fact, similarly goes to the smokers, because it is not to reduce the harm, and also it does not help smoker to stop smoking. And we'd like to highlight this, the clinical practice guideline also available on our website, treatment of tobacco disorder. So, Ministry of Health is planning to revise this CPG, and the component for electronic cigarette will be added in the revised version soon. Right. So, what are the alternatives for those who want to quit smoking? Rather than starting down on electronic cigarette, right? So we have nicotine replacement therapy. I'm sure you guys know this already. We have gum and patch. I think the inhaler or mist is not yet available, so we're waiting for approval from the NPRA. How about this one? Champix. Currently, this product is not available in the market, and I think it will resume its supply somewhere at the end of this year. All right. So this is like a tablet kind. So when we say to recognize electronic cigarette as a treatment for quit smoking, there's actually a lot of stages to register this if you will want to. So for a product or a medicine to be recognized as a treatment, so they need to go through processes. You need to identify the safety, the efficacy, the suitability, the cost, also the prescription. So as for now, our electronic cigarette is not regulated, but it is not for prescription. So as Ministry of Health, even the WHO is we don't recognize electronic cigarettes for speaking for now. And so zombie.com, so those who want to quit smoking, you can refer them to this website, they can register, And if you yourself, for your own private practice, if you want to become provider, you can also go to this website to become the provider. So you have a course called Certified Smoking Cessation Service Provider. So you can register yourself there and get yourself trained, and then you can start providing the service. So again, I want to highlight the electronic cigarette or vape is not a thing for smoking. Please don't offer that to your client smoking. And of course, again, I would like to repeat, you need to know your client status and please don't be smoking on vape history. And of course, do the basic training and advise them to quit and initiate the treatment. And if not, you can always refer and you yourself become an educator and use the ideas mentioned by Dr. Mah this time. But I think that's my last slide. Thank you so much. So I pass back to you, please.
Okay, thank you so much for thank you, Dr. Nurhaliza, for your insights, and I believe everyone would agree that that today's presentations have been quite insightful and interesting. So we will now move to the Q&A session. So we do have a question from Zarul Naim Mohamad, a general practitioner, who asks, what is your opinion regarding the removal of liquid and gel nicotine from Drug Control Act by the Health Minister? Is it a way forward or backwards? So I think I can direct this question to Dr. Haliza.
Thank you for the question. All right, so we all aware that nicotine has been removed from the Food Act, right? I know this is like a consensus kind of decision, but of course we are working hard to make sure this is regulated in the upcoming bill. You know, so we are trying to push forward a bill to control the what we call smoking product, which includes vape. So we hope that with this new bill, we will able to regulate the tobacco product and include vape and of course the nicotine abuse.
Okay, thank you for your answer. If there are no other questions, we can wrap up today's session with maybe a takeaway message from each speaker. So I think we can start with Dr. Wen Yi. Oh, sorry, there is one question actually. Oh, sorry, yeah, no, never mind. So yeah, like I said before, I think we can wrap it up with maybe takeaway session from each speaker. So I think we can start with Dr. Wen Yi.
All right, so I'll just speak on behalf of Dr. Murali, but basically the main takeaway from Dr. Murali's slides is that we need to all be active tobacco control advocates. And I'm really glad that Dr. Haliza touched on e-cigarettes rather than just the traditional tobacco cigarettes. And that's basically our whole point of the Advocacy series. So yeah, I think it's important for healthcare professionals to be educated on the harms of tobacco and also the potential harms of e-cigarettes as well. And then with our own knowledge, then only we can become better advocates for our patients and also for tobacco control. So that's all from me.
Thank you, Dr. Wen Yi. Dr. Haliza, do you have your takeaway message?
All right, so I think we in Ministry of Health ambition the country to be free from smoking habits, you know, like a smoke-free country kind of thing. Of course, we need a lot of collaboration, we need a lot of support from everyone. So we urge everyone to support Ministry of Health, support the NGOs, support any activities that can push our agenda forward. Hopefully, we can see the bill tabled in the next parliamentary session. And again, I would like to emphasize that as for now, we do recognize electronic cigarette as one of the quit smoking method. So you just have to, we will see more evidence coming to show the harm of electronic cigarette. And of course, we hope we are not going to fight alone. That's why we hope everyone will be together with us in this, like a war, yeah, like a war fighting for our health. All right, thank you. That's all for me.
Okay, so thank you everyone for the questions, and also thank you to our speakers for this insightful talk. So that brings us to the end of today's webinar. Once again, thank you to our speakers for sharing their expertise regarding today's topic, and to the audience for tuning in. We hope that this webinar has offered you with a valuable insight and has provided you with better understanding on the crucial topic. Don't forget to tune in for our next webinar, which is in regards to the rocky road ahead challenges from harm reduction to a tobacco-free generation, which will be on Friday, the 26th of May, from 2 p.m. to 3 p.m. And those who are interested in our previous webinars of the series, you can visit our website, our YouTube channel, that is the National Cancer Society of Malaysia. And the webinars are in a playlist called Harm Reduction in Tobacco Control. So thank you for joining us today, and we hope to see you guys soon.